Tell me, Janet, what's the story with this little budgie?
Okay, when I bought him, I noticed that his breathing was laboured.
Yes.
He's got some discoloration around the cere.
Yes.
And he yawns a lot.
Right. How long have you had him?
6 weeks.
He's got
poo on his bum.
Right. Poo sticking in his bum?
Well, not really. Well, not just because he's a bit... Okay. Normally he's in the cage with Percy, and he's very, very active, eats well.
Yep.
But I noticed he sneezed. He sneezes and...
Yep.
He's not tall tame, so...
Okay. Not tame. Okay.
All right. She'll go into the cage with Percy.
All righty. Well, what did I say? Hi. Hello, little fella. Hello, little fella. Well, he's an English style, you know, show stock type budgie rather than a little Australian budgie with the great buffy head and the feathering like that. I don't know how he rates as a show bird, probably not, but he's got a slightly sore right eye. It's a little bit inflamed, and that partly may be due to feathers coming across and sitting over his eye, which is quite common in these show birds. But anyway, it's not, just looks a little bit sore, and again he's got an overhang of feathers on this eye where the feathers tend to poke into his eye sometimes, right? And it's just the difference, it's excessive feathering, which is genetic. What we're doing to budgies that we shouldn't be doing.
Okay. Mangly,
we're making them into British bulldogs. Anyway, and no offence to beautiful British bulldogs in terms of their personality, but what we've done to them to make them suffer and... Right, okay. The ring is a 0-0. That looks like a 0-0 to me, anyway. Alright. He does have a bit of a soiled vent. Part of that can be due to excessive feathering around the vent, which is all part of this showbird syndrome that some people insist on breeding to, which doesn't account for his crop feels empty. I'll do a fecal smear. His body condition is okay.
but he gasps.
The bottom of his feet are okay. I'll just hold him to the light and see if I can see any creepy crawlies. I think he does have feather mites. To prove that I'd need to trim a little feather under the microscope, but I think you can take my word for it that he has feather mites along the shafts of the feathers. They're like little dots when you look through the feather from this side, from the other side. He doesn't have a lot of them, but he has some, and we might as well get rid of them. So I would suggest you spray him with avian insect liquidator.
Yep. Spray
the underside of the wings and the underside of the tail, and just smear a bit on his head with your finger. Do that once a month for 3 to 4 months, and that should solve that problem. The respiratory signs, the staining, just the dirty look across his face and so forth, is indicative of chronic respiratory disease, even though his cere is a perfect colour, healthy colour, and his nostrils are clear. Until otherwise proven differently, I generally treat that as chlamydia or psittacosis, and it can be due to vitamin A deficiency from his diet, and just the seeds and things. If that's all, yeah. But if he had been on that sort of diet, on just a seed-based diet for a while, that can induce vitamin A deficiency, can predispose minor upper respiratory tract infections. He doesn't look like a severe one. I'll just have a listen to his chest and see if there's anything there. And then we'll do a crop and fecal smear in view of you saying that he's been doing a little bit of gagging or yawning.
We do it now. This is good. I thought he had air stack nights or something.
I'm not hearing anything this way. That's abnormal, I mean. Just quietly. I'm using the chopstick grip to secure him, and I'm sending the intent to calm him when I remember to do so. When I'm talking. Okay. Just have a feel of his tummy, just quietly. His tummy is concave, abdomen is concave the way it should be. His liver is not grossly enlarged, so that's all good. That's the way it should be. See? Just calm. Calm, 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 calm. Right, weigh him. Just weigh him. Just come, baby.
Because I rang the birds and they said, oh, he's probably got air sac mites. Bring him round, we'll give him doxycycline or something.
Ear sac mite is very, very common in Guildian finches. It's very, very common in canaries. It's not common in budgies. 46 grams. 46 grams. Okay. We'll take a little bit of his foot for under the microscope examination.
Nice and fresh.
Yep. So the next step is making a smear.